A lot of people will ask, what exercises can I do to help with my knee arthritis? A lot of patients are really curious about exercises that can be done to help with knee arthritis. Hey everyone, it's Dr. Jess Sally with Regenexx Pittsburgh, your Southwestern Pennsylvania premier providers of interventional orthopedics and non-operative interventional treatment. Today I wanted to talk to you a little bit about exercise for knee arthritis. In general, strengthening exercise does have a really strong effect in terms of providing better joint stability and helping with reducing stress on the knee to help with reducing pain and improving functional activity in general. A lot of major institutions like the Center for Disease Control will recommend about 150 minutes of moderate intensity exercise activity over the course of about a week. You can break that down to probably about 30 minutes over the course of about 5 different days. Whether that's brisk walking or whether that's stair climbing or maybe light bike riding, anything that just gets the heart rate up a little bit can be considered aerobic activity. In addition to that, they also recommend anywhere from 2 to 4 days of more strengthening or resistance-based exercise. The issue that I usually address with patients is how much activity can patients actually tolerate, and how much does that either increase or control a lot of the pain that they have in joints or the knee specifically. To better help guide patients, a lot of times I'll refer people to physical therapy to get better assessments of patients' baseline function, how they move, how their joints move, and just to test different strength levels with different types of exercise, both with strengthening and functional activity. Most exercises that we want to utilize to help with controlling knee pain tend to come from areas that aren't actually around the knee. A lot of times patients might have weakness in the quadricep muscle, which is the large muscle on the front of the thigh, or they'll have weakness in other large muscle groups like the hamstring or the buttock muscles on the backside of the hip. Those muscles, unbeknownst to a lot of people, are what really help with controlling the knee and helping to stabilize the knee when we walk or climb stairs or squat to pick things up off of the floor. A good exercise program to help with strengthening and retraining these muscles will help to also reduce stress on the knee and therefore help with any pain that might be happening from the joint. Muscle weakness can also result in additional stress on the tendons around the knee. So sometimes having weak muscles may result in tendon-based pain that isn't necessarily directly related to the joint, but still causes a lot of pain and discomfort around the joint, making it difficult for people to engage in certain activities as a result. Sometimes these tendon pains can also be mistaken for joint pain, and patients may be frustrated when injections in the joint from other providers may not provide as much relief as they expect. If you have been working through an exercise program, or if you've had treatments in the past that have not been effective in terms of alleviating your joint pain, you should check out some of our other videos related to treatments that we utilize to help with reducing knee pain from osteoarthritis or other related issues to help with reducing pain and improving function. In a lot of cases, even after we perform non-operative treatment interventions, I will have patients progress back into a course of physical therapy to help with additional guidance in terms of appropriate muscle strengthening, appropriate muscle mechanics to help make sure that patients are moving in a way that makes sense and moving in a way that's going to help them with their general function. I usually use the analogy of replacing a tire on a car. If you put a new tire on a car, but you don't balance and align it, you run the risk of just wearing that tire out in the same way that it has been in the past. So when we utilize these treatments to help give people pain relief, we also want to help with making sure that their muscles are helping to move their body in a way that's going to make sense for them. For varying patients, people are going to be able to tolerate different levels of strengthening activity. What exercises work for some may not be the same exercises that work for others. That's why it takes a trained eye and a good evaluation to help with making sure that we're providing the appropriate exercises so that we can give you the strengthening tools that you need to move forward with the functional activity that you want to engage with. So while movement is good for joint pain, Movement and appropriate movement, along with good strength, are what are optimally needed to make sure that you're doing the activity in a way that's not going to cause more problems down the road. So if you feel like you've been doing exercise and you've plateaued with being able to gain additional pain relief, go to our website and check out some of the additional treatments that we offer that can be very helpful for reducing knee pain, so that going back to physical therapy and continuing to advance your strengthening can only lead to improvements in your function and continuing to improve pain in your day-to-day life. I'm a big believer in strengthening. I'm a big believer in patient exercise. I'm a big proponent of the fact that good muscle strength and good muscle stability will also translate into better joint mobility and better joint stability. I want to try to help you to get to a place where you have better strength, where you have better functional strength to help you engage in the activities that you want to engage in with much more ease. And I want to be able to provide treatments that are going to help with reducing pain so that we can get people back to activity and get people stronger so that we can have better function as we go on in years.